Problems in older adults are often ignored because they appear slowly over time. Low energy balance problems, memory changes, or sudden weakness are sometimes mistaken for normal aging. But in certain cases, these symptoms may actually signal underlying health problems that need medical attention. The body becomes more vulnerable to weakness, falls, dehydration, and chronic illness later in life. And recognizing these symptoms early may help reduce the risk of more serious complications in the future. Number 1. Constant fatigue. Tiredness can become more common with age, but exhaustion that continues every day, even after resting, should not be ignored. Ongoing fatigue may sometimes be linked to dehydration, anemia, poor sleep, low nutrition, or underlying heart problems. Over time, low energy can reduce mobility, muscle strength, and the ability to stay independent. When simple daily activities suddenly feel harder than usual, the body may be signaling that something needs attention. Number 2. Dizziness or feeling unsteady. Balance problems may appear minor at first, but repeated dizziness can increase the risk of falls and injury in older adults. Possible causes include dehydration, low blood pressure, medication side effects, or inner ear problems. In some cases, balance issues may also be connected to circulation or neurological conditions. Dizziness that happens often while standing or walking should always be taken seriously. Number 3. Body weight dropping without trying. Body weight dropping without trying is not always considered a normal part of aging. It may happen because of reduced appetite, difficulty chewing food, or eating less over time. But it can also be linked to digestive problems, illness, depression, or muscle loss. Too much muscle loss later in life may increase weakness, frailty, and the risk of falling. Number 4. Memory problems that affect daily life. Occasional forgetfulness can happen at any age, but memory problems that interfere with routines or safety deserve medical attention. Examples may include forgetting medications, repeating the same questions often, getting lost in familiar places, or struggling to follow conversations. Memory changes can sometimes be related to poor sleep, medication effects, vitamin deficiencies, or cognitive decline. Number 5. Slower walking speed. Walking more slowly over time may seem harmless at first, but slower movement can sometimes reflect reduced strength, balance problems, joint pain, or lower endurance. Research has also linked slower walking speed in older adults to declining overall health and a higher risk of falls. Number 6. Sleep problems every night. Waking up more often during the night can become more common with age, but ongoing sleep problems may affect memory, mood, energy levels, and immune function. Lack of quality sleep may also increase the risk of confusion, weakness, and falls in older adults. Number 7. Loss of appetite. Eating less over time may increase the risk of poor nutrition. Without enough protein, vitamins, and fluids, the body may become weaker much faster later in life. Number 8. Swelling in the feet or legs. Occasional swelling may happen after sitting too long, but swelling that continues regularly may sometimes be linked to circulation problems, heart issues, or medication side effects. Number 9. Sudden confusion. Confusion that appears quickly should never be ignored. In older adults, it may sometimes be triggered by infections, dehydration, medication reactions, or other underlying medical conditions. Number 10. Bruising more easily. Skin becomes thinner with age, but frequent bruising may also be connected to medications or health conditions affecting blood vessels. Number 11. Weaker grip strength. Difficulty opening jars or holding objects may seem minor at first, but weaker grip strength has sometimes been linked to muscle decline and reduced physical function. Number 12. Frequent nighttime bathroom trips. Waking up multiple times during the night may interrupt sleep and increase the risk of falls. In some cases, it may also be related to bladder or prostate problems. Number 13. Shortness of breath during simple activities. Becoming out of breath while walking short distances or doing light tasks should not be ignored, especially if it appears suddenly or worsens over time. Number 14. Becoming less socially active. Pulling away from hobbies, conversations, or social activities may sometimes be connected to fatigue, hearing problems, depression, or cognitive changes. Number 15. Hearing problems that slowly get worse. Difficulty hearing conversations may seem like a normal part of aging at first, but untreated, hearing problems can sometimes increase confusion, social isolation, and memory difficulties. Over time, people with hearing loss may also begin avoiding conversations or social situations without realizing how much it affects daily life. In some cases, hearing problems may improve with proper treatment, hearing devices, or medical evaluation. Number 16, muscle weakness in the legs. Weak legs can make standing up, climbing stairs, or walking longer distances much harder over time. And muscle weakness may increase the risk of falls, fractures, and loss of independence. Possible causes include inactivity, poor nutrition, nerve problems, vitamin deficiencies, or muscle loss related to aging. Staying physically active and maintaining enough protein intake may help support muscle strength later in life. Number 17, ongoing constipation. Constipation becomes more common in older adults for several reasons, including lower activity levels, dehydration medications, or reduced fiber intake. But constipation that continues for long periods should not be ignored. It may sometimes lead to pain, appetite loss, bloating, or other digestive complications. Doctors often recommend enough fluids, physical activity, and fiber-rich foods to help support healthy digestion. Number 18, dry mouth all the time. Constant dry mouth may seem minor, but it can affect eating, swallowing, speaking, and dental health. In many cases, dry mouth is linked to medications, dehydration, or certain medical conditions, and without enough saliva, the risk of tooth decay and mouth infections may increase. Over time, drinking enough fluids and discussing medication side effects with a doctor may help reduce symptoms. Number 19, trouble standing up from a chair. Difficulty standing up without support may sometimes reflect declining leg strength, joint problems, balance issues, or reduced mobility over time. This problem can make daily activities more difficult and increase the risk of falls inside the home. Experts say reduced lower body strength is one of the major factors linked to physical decline in older adults. Exercises that support balance and muscle strength may help improve mobility and independence later in life. Number 20, shaking hands or body tremors. Mild shaking in the hands may sometimes appear with aging, but tremors that become more noticeable over time should not be ignored. In some cases, shaking may be linked to medication side effects, stress, nerve conditions, or neurological disorders. And when tremors begin interfering with eating, writing, or daily activities, medical evaluation may be important. Changes in movement or coordination can sometimes become worse, gradually making early attention more helpful. Number 21, trouble swallowing food or drinks. Difficulty swallowing may increase the risk of choking, dehydration, and poor nutrition in older adults. Some people begin eating less because swallowing becomes uncomfortable or difficult, without fully realizing it. And in certain cases, swallowing problems may be connected to muscle weakness, neurological conditions, or other underlying health issues. Coughing during meals, food feeling stuck, or repeated throat clearing after swallowing should not be ignored, especially when symptoms happen regularly. Ignoring these symptoms may allow health problems to become worse. Over time, paying attention to early signs and seeking medical advice when needed may help older adults stay healthier, safer, and more independent longer.